Hi, I'm Dr. Saqib Mansoor, and our today's topic is dural venous sinuses. And the definition of the dural venous sinuses is that these are the spaces lined by endothelium, and they lie between the periosteal and meningeal layer of the dura. And they form where the dural septa attach along the free edge of the falx cerebri and in relation to the formation of the cranial floor. And they have no muscle in their wall and they are valveless. No muscle in their valves, they are valveless. And the large veins from the surface of the brain empty into these sinuses, and most of the blood from the brain ultimately drains through them into the internal jugular veins. So here you see the dural venous sinuses. These are the things. This is the general description I've just told you. And this is how they are classified. They are paired or unpaired. Paired are those which are in the form of two, one on each side, and unpaired is just occurs singly. So we just first go through their nomenclature, the names. The paired ones are the cavernous sinuses, then the superior petrosal sinus, then the inferior petrosal sinus, then the transverse sinus, the sigmoid sinus, the sphenoparietal sinus, and then the petrosal sinus. So these sinuses are paired, they occur on both sides. So then are the unpaired venous sinuses. So these are the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, the occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus, and the basilar plexus of veins. These are the unpaired venous sinuses. So if you could see here, as I told you, that these are present, the sinuses, I repeat, formed between the meningeal and periosteal layers of the dura, and these are formed in relation to the dural folds, like this dural fold, falx cerebelli, falx cerebri. So if you identify that this is the falx cerebri, right? This is the thing. If you remember the knowledge of the dural folds, this is the falx cerebri. It starts from this stageli. It's going backwards over here, and here it forms a tentorium cerebelli, which you can see over here. So you can see this is the tentorium cerebelli. It covers cerebellum, right, in the posterior cranial fossa. This is tentorium cerebelli, and this is the falx cerebri. So these are the main two folds of the dura where we are concerned with the formation of our sinuses, the dural venous sinuses, which could be the paired or unpaired. So to first identify the paired ones, in their spotting, you can say sort of. So these are the cavernous sinuses. First of all, the cavernous sinuses here, it's on each side of the sella turcica on the body of the sphenoid bone. Cavernous sinuses on each side of the sella turcica on the body of the sphenoid bone. These are the cavernous sinuses. They are the paired sinuses. That is our superior petrosal sinus. Another one is the superior petrosal sinus. You could see this is the superior petrosal sinus. I will give you a brief description of the each. After that, we first identify that. This is the superior petrosal sinus. It is starting from this cavernous sinus going down into the junction where is the sigmoid sinus and this transverse sinus. Sigmoid sinus and transverse sinus. We first identify them. So this is the superior petrosal sinus on each side, and then is our inferior petrosal sinus. This is inferior petrosal sinus on each side, and this is again you see this is our superior petrosal sinus. This is superior petrosal sinus, and this is inferior petrosal sinus. And the fourth paired sinus is a transverse sinus. So as you could see, this is the sinus. This is the right one, transverse sinus, and this is the left transverse sinus. You could see, yes. This is the left transverse sinus, and this is the right transverse sinus. And then you could see the paired, another one is a sigmoid sinus. Sigmoid sinus. And a very important point to be highlighted is that all the dural venous sinuses, they ultimately drain their blood into the internal jugular veins. And internal jugular vein, how it is formed? As the sigmoid sinus continues through this foramen, which is a jugular foramen, it forms a internal jugular vein. So you could see, I will show you another picture very soon. Yes, you could see over here even. Yes, this is the, internal jugular vein. This is internal jugular vein, and blood from all these venous sinuses, you could see here, all the venous sinuses. You could see the spotting, yes, so what is it? And it's just ultimately drained into this internal jugular vein. This is the ultimate site of this, right? So this is the, I have to point it out. And then is the, after the sigmoid sinus, there is the sphenoparietal sinus. Sphenoparietal sinus. This is the paired one as well. So this was a few sinuses we could identify in the paired ones. And as we move to the unpaired, this is the, first of all, this is the superior sagittal sinus. You could see this is the superior sagittal sinus. So present in the, this is the upper attached margin of the falx cerebri. This is the falx cerebri, and it's just the upper attached margin. And here it starts at the crista galli, and it's going down into the point which is the confluence of the sinuses. I will describe to the four sinuses here meet, and the meeting point of these four sinuses you could see there, and this is the confluence of sinuses. So this is the superior sagittal sinus present in the attached free portion of the our this falx cerebri. Then is the inferior sagittal sinus. This inferior sagittal sinus. You can see the pointer. This is the inferior sagittal sinus. It is present in the concave free border of the falx cerebri here. And it then drains here into the straight sinus. It comes straight and drains the joins straight sinus. And then the third unpaired sinus is itself straight sinus. Here it is. This is the straight sinus. The straight sinus at our this inferior petrosal sinus joins it with the great cerebral vein, and here is formed the straight sinus. You can see the formation of the straight sinus by the great cerebral vein joined by this inferior sagittal sinus to form the straight sinus. And then we have the occipital sinus, and it is somewhere here, not shown in this picture, occipital sinus, and it would be here as well in the confluence of the sinus, and also it is the confluence, it is present on that is unpaired, and it drains into the confluence of the sinuses. Then is the anterior intercavernous sinus, this anterior intercavernous sinus, and then is the posterior intercavernous sinus, right? So these are the communications to join the various tributaries of the cavernous sinus, anterior and posterior intercavernous sinuses. And in the last, there is the, of the unpaired venous sinuses, the basilar venous plexus, which is the sinus. Basilar venous plexus veins. This is present over here. The various connections and drainage will be coming very soon later on. So this was the spotting you could see again, right? And you see another important point, right? This is the pterygoid plexus of veins. This is the pterygoid plexus. And here we will discuss clinically very important area, which is the danger triangle of face. And I'll show you the picture and the communication. You could identify here, right? This is a pterygoid plexus. And there are the veins, the superior thalamic vein, and the inferior ophthalmic vein, and particularly from the face, the superior ophthalmic vein has a direct communication with this, our cavernous sinus, and from this triangular area of face, which is the upper nose, from the upper lip and to the tip of the nose, and infection can spread directly into the cavernous sinus. And I have to point that cavernous sinus will discuss with you in a separate lecture of mine, which you will be separately discussed. So important, its thrombosis and its communications, its relations. So everything deserves a separate discussion. So I've decided the detail of cavernous sinus would be discussed separately along with the about this applied anatomy as well. So this is the point. So you see, this is the superficial facial veins. So have direct connection with the cavernous sinus. Like here is a common occurrence. Mostly females have a pustule or the pimple, and they squeeze that, and the infection directly drains into this cavernous sinus. So very dangerous. So this was the spotting over here. This is the here, right? And as we move on, you could see identify again a very simplified manner from here. This is the superior sagittal sinus and going into this confluence of the sinus posteriorly. This is the where the internal occipital protuberance. And this is the our inferior sagittal sinus, and this goes here into joins the straight sinus. Or it is formed straight sinus as the inferior sagittal sinus joins with great cerebral vein. I'm repeating. So this inferior sagittal sinus, and this is the straight sinus formed, and this again goes into this confluence of sinuses. And here you could see this is the transverse sinus, right? This is this drains this confluence of sinus, transverse sinus, right side and left side. And left side is mostly dominant, it's larger transverse sinus. So this now transverse sinus drains into the sigmoid sinus, both sides. And here we also has this occipital sinus. This is the occipital sinus, you see. And this occipital sinus is drained also into this confluence of the sinus. Occipital sinus comes along this dash margin of the tentorium cerebri, and it drains into the confluence of the sinuses, right? So this is it. Also has this occipital sinus communication with this cavernous sinus. You see this. And this is the continuation of the transverse sinus into the sigmoid sinuses, which itself continues from the jugular foramen into the as the internal jugular vein. That's shown you already. So this is the point, and then this is the cavernous sinus. Again, repeat, present on both sides of the sella turcica on the body of the sphenoid. And this is the sphenoparietal sinus draining into that. And this is the superior petrosal sinus and the inferior petrosal sinus. So superior petrosal sinus drains it into where is this is the transverse sinus junction with the sigmoid sinus. This is the junction of the transverse sinus with the sigmoid sinus, and the superior petrosal sinus drains blood from the cavernous sinus into this junction. This superior petrosal sinus, here it is, yes. And this inferior petrosal sinus, this from cavernous sinus, it drains the blood into this point, into the, say, directly into the sigmoid sinus. So where these petrosal sinuses are located, you could see easily, of course, this is the petrous part of the temporal bone, and the superior petrosal sinus is located in front of that petrous part of the temporal bone. This inferior petrosal sinus is located behind that posterior part of the petrosal bone. So this petrous temporal bone. So this is the point. This is the location. And these sinuses groove the bones, they erode the bones to which they are attached. Like this is the transverse sinus. Of course, it will be grooving the this or your occipital bone and so onwards. So this is somewhat again a more elaboration of the points in detail, which is written for your perusal. And I've already told you, so the confluence of the sinuses, where these are the four sinuses meet: straight sinus, superior sagittal sinus, occipital sinus, and the transverse sinuses, right? Told you already. This is the confluence, right? These four sinuses are meeting over here. This is the point I told you already. So this is the straight, superior sagittal, occipital, and transverse sinus. This is the confluence. And then you could see the superior sagittal sinus, of course, receives the superior cerebral veins and communicates on each side through slit-like openings with the lateral venous lacunae, lateral expansion of the superior sagittal sinus. So this is the point. Then the arachnoid granulations, which is also known as the Pacchionian bodies. So you could see, identify first of them. Yes, these are the arachnoid granulations. And this is the superior sagittal sinus. These are the granulations. There is a term known as the arachnoid villi. Let's study its definition. Arachnoid villi. These are the tufted prolongations. Tufted prolongations of the arachnoid that protrude through the meningeal of the dura mater into the dural venous sinuses, especially the lateral lacunae, and they affect the transfer of the cerebrospinal fluid to the venous system. So this is, you see, this is mostly the arachnoid granulations are formed in relation with the superior sagittal sinus, and they are the tufted prolongations, the arachnoid villi, the tufted prolongations of this arachnoid matter into these sinuses, concerned with the CSF drainage. So if the arachnoid villi are enlarged, especially in old age, they are called as arachnoid granulations. So if they are more enlarged, they erode the bone and they produce arachnoid foveolae. You see various spottings over here. This is the meningeal layers, you know already, right? These are cranial meninges. This is the point, right? This is pia mater. This is the arachnoid matter. And this is the meningeal layer of the dura. This is the periosteal layer of the dura. These are the three cranial meninges. These are the bridging veins. So this is the pericranium. These are the 5 layers of the scalp. I have had a lecture of the scalp with you already, explaining each and every bit of this scalp with you, right? This is the gallia panoritica. This is the danger area of the, loose areolar tissue, the danger area of the our scalp. So this is the various, these you could see very important thing. This to tell you later on in a bit of detail. This is the emissary vein. This is the emissary vein, right? So this is a connection of these venous sinuses with the extracranial veins. So this is the inferior sagittal sinus, I told you, and then the straight sinus, I've told you how it is formed. So the transverse sinus, I told you already the detail of how it is formed and where it is located. So transverse sinus is run along the posterolateral attached margins of the tentorium cerebelli, where they become the sigmoid sinuses, reaching the posterior aspect of the medius temporal bones. I told you already. Then the sigmoid sinuses, right? Sigmoid because they are S-shaped course. They follow an S-shaped course in the posterior cranial fossa. So they groove the, told you already, temporal and occipital bones. So this is the also they continues as the internal jugular vein. I told you already. Then the occipital sinus, this is already told you, just repeating, lies in the attached part of the falx cerebelli and superiorly in the confluence. So this is the point. Occipital sinus communicates inferiorly with the internal vertebral venous plexus. So this is the cavernous sinus, showed the spotting. So it comprises of venous plexus of highly thin-walled veins, extend from the superior orbital fissure anteriorly to the apex of the petus part of the temporal bone posteriorly. I've told you intercavernous sinuses, anterior and posterior, and the drainage, the relations, and in detail, and its relations, and what structures go through its wall. This is tell briefly. Passing through its substance are the internal carotid arteries. Two structures pass through its substance, which is the internal carotid artery and the sixth cranial nerve, the abduction nerve. And these four nerves are present in its lateral walls. You can see this is the maxillary nerve, and this ophthalmic nerve, and these are the parts of the fifth cranial nerve. Only the mandibular nerve, third part of the trigeminal nerve, does not pass through the wall. And this is the trochlear nerve, and this is the oculomotor nerve. These are the present in the lateral wall of the cavernous sinus. Right? You could see this. Of course, this lies on the body of the sphenoid, below which is present are the sphenoidal layer sinus. So they are drained through the superior and inferior petrosal sinuses. I told you already briefly. The last I will go back to the picture to just briefly explain that. This is superior petrosal sinus. Told you already. This is a description of the inferior petrosal sinus. Told you already. And a few words about the basilar plexus. Connects the inferior petrosal sinuses and communicates inferiorly with the internal vertebral venous plexus. So these are the Mishri veins. I told you know already when I discussed with you the skull. These connect the dural venous sinuses with the veins outside the cranium. I just told you, although they are valveless and blood can flow in both directions, but usually blood flows away from the brain. So they vary in number and size. So what are the commonest Mishri veins? First of all, let's discuss. Frontal Mishri vein, parietal Mishri vein, mastoid Mishri vein, right? We studied them when we studied the normas. And another less common is the posterior condylar Mishri vein. So what's the frontal Mishri vein? It is present most in children and some of the adults, passes through the foramen cecum of the cranium. And a parietal Mishri vein, and it passes bilaterally through the parietal foramen. So the mastoid Mishri vein passes through the mastoid foramen and connects each sigmoid sinus with the occipital or posterior auricular vein. And the posterior condylar Mishri vein passes through the condylar canal connecting the sigmoid sinus with the suboccipital venous plexus. And here is another, this is the primary tributaries of the connecting into the sinuses. These are the primary tributaries of these venous sinuses. Like one of those would be superior, cerebral veins, right? This is the superior cerebral veins. You identify the superior cerebral veins. You see the flow of the blood. Yes, you see. And this is the, I think that's the superficial middle cerebral vein. This is the inferior anastomotic vein. So this is the various veins going into that. This is the superior anastomotic and superior sagittal sinus. This is the superior sagittal sinus. This is the inferior sagittal sinus. There's blood flowing into that, and ultimately whole blood going into this internal jugular vein. This is the formation of the, here is the confluence of the sinus, and from here the blood goes into the transverse sinus, and on each side. And this is the sigmoid or S-shaped course of the sigmoid sinus, and here is the jugular foramen, and then it continues as sigmoid sinus continues as the internal jugular vein. So ultimately the whole blood from these sinuses goes into this internal jugular vein. So let's study that that way, cerebral and cerebellar veins. These are the primary tributaries which drain into the sinuses, dural venous sinuses, and the cerebral and cerebellar vein pass across the subdural space to the drain into the sinuses. Similarly, I told you Mishri veins detail. You know already the diploic veins straight drain the spongy bones or the diploe of the flat bones. I told you arachnoid granulations, and the meningeal veins drain the meninges. So this is before going to the clinical anatomy, just for 2-3 minutes. I will go back to this picture like this, and just you see identify again a few spotting of that. This is, you could see where the paired venous sinuses and the unpaired ones, right? This was a cavernous sinus, was very important clinically, and its thrombosis, I told you already. This is the uh, situated, this is location on the front of, on the sella turcica, uh, in front of the, on the, our this bone, sphenoidal bone. So the body of the sphenoid, see, connected by this intercavernous sinus. These are intercavernous sinus, interior and posterior are unpaired as single, and this cavernous sinus occurs on both sides paired. And similarly, this is the sphenoparietal sinus, and this, this connects the superior ophthalmic sinus, and this is present bilaterally paired, and it has a communication with this cavernous sinus. And you see the superior ophthalmic vein. This I told you. This has a connection with the this our cavernous sinus, and this superior ophthalmic vein, and then we see this is the over this superior petrosal sinus present in front of the petrous part of the temporal bone, and then is inferior petrosal sinus, right? This is the basilar venous plexus, right? And then this is the, you see here, you could see this, just back to this picture, this is the superior sagittal sinus, this is the inferior sagittal sinus. I told you the description, and this you see, right? So this is the confluence, and all this confluence is formed. These are the various contributing sinuses, like this is the superior sagittal sinus, and then the straight and the occipital sinus, straight sinus, the occipital sinus, and fourth is the transverse sinus. These four sinuses form this confluence. Transverse, this superior sagittal, and this straight, and this occipital. These four sinuses form the confluence. You could see this, yes. And any other point of to identify is that, yes, this is the our great cerebral vein, and it joins this great cerebral vein, and it joins the inferior sagittal sinus, inferior sagittal sinus joined by this um, great cerebral vein and forms a straight sinus. So of course, it comes into confluence, and confluence continues as the drains into the both sides, right and left, as a transverse sinuses, right and left. The left one is larger, which now continues or towards as the sigmoid sinus as shape, which now drained into the internal jugular vein. So again and again, I'm repeating that the ultimate drainage of all these sinuses into the internal jugular vein. You could see all this, and there you see. So I think no point is left important, and no clinical anatomy. A few points at this end are left. Let's discuss that. So this is the danger triangle of the face. I've told you already, you can identify this is the danger triangle of the face. Right from the upper lip, this area, to the this bridge of this nose part of the nose, right? And triangular face from the upper lip to the bridge of the nose. This is the danger triangle. And if there is any pimple squeezed out of here, will go directly into the through the venous connection, superior thalamic vein, and that will go into the over this cavernous sinus. I've told you this connection, and I will again tell you when we study the cavernous sinus. This is the danger triangle face. So this is the point. I repeat this connection. I feel like that should repeat that. This is the point. This is the superior ophthalmic vein. This is inferior ophthalmic vein, right? These are various connections. This is the pterygoid plexus, right? And this is the deep facial vein. And this the various will describe. If you recall your venous system of the face, and you see these connections with the about this cavernous sinus. So any laceration of the nose or squeezing of the pimples, I've told you that already. So occlusion of the cerebral veins and the dural venous sinuses. It may result from thrombophlebitis, or tumors like meningiomas. Mostly involve sinuses, the transverse, cavernous, and petrosal. So metastasis of tumor cells to dural venous sinuses. The basilar and occipital sinuses have communication with the internal vertebral venous plexuses, as the venous sinuses are valveless, a compression of the thorax, abdomen, or pelvis, which may occur during heavy coughing and straining, may push venous blood from these regions into the internal vertebral venous system and from here into the dural venous sinuses. As a result, pus in abscesses and tumor cells in these regions can spread to the vertebrae and brain. So this is the discussion of the, our cavernous sinus, and so very soon next we'll be discussing the fascia coli, the system of the deep cervical fascia, deep fascia of the neck, and we hope we'll meet very soon, and till then it's good.